I would like to invite all the speakers to come to get the microphones. And we will have Fernando Cassinello moderating the session. So when we were searching for a moderator, I explained to our Spanish colleagues that we need someone who can bring the telemedicine from all its aspects. And Fernando accepted to do this difficult task. So enjoy your session.
Well, hello everyone. Thank you for attending this section. We have six speakers, so we're going to try to speak all of us and have time for your questions. So, without delay, I will begin to introduce my colleagues. And first, we have Eduardo Arteaga-Bracho, which is he's a seasoned clinical development specialist with extensive experience in integrating digital health technologies into the medical devices sector, working in telemedicine. Viktória Ďurajová is a project manager for science, research, and innovation at Roosevelta Hospital. And as a project manager, she covers a wide range of projects related with the introduction of innovations. And she played a pivotal role in the preparation and implementation of the hospital initial telemedicine projects. So she will have a great view of what is about beginning with telemedicine. Michael Wagner, nice to meet you now. He's a neonatal consultant at the Medical University of Vienna and has a lot of experience in this field. Alvarez Pagola is our patient advocate. For me, the first and more important of the session speaker. She's also an educator who lives with type 1 diabetes herself, so it's a great pleasure to have her here. She's a prominent member of the International Diabetes Federation Blue Circle Voices Network, and she's involved in various projects and initiatives aimed to improve the lives of people living with diabetes in Nuria, the DOC, and Asociación Diabetes de Madrid. Ignacio Boch, he's a lawyer, so any problem with law or patient, you have him here. Lawyer specializing in healthcare law, being his background in the actuarial science, having worked with both public and health services and insurance companies. He has an exceptional insight into the healthcare industry. A member of FIDISP and teaching innovation and in patient safety and research organization. Nuria Hill is our 1.5 speaker more. She is Service and Solution Director in Philips Iberia, leading the healthcare business operation and delivery for the Philips healthcare portfolio during their entire lifetime. Shorter than mine, but entire. And my name is Fernando Cassinello. I am an anesthesiologist, and I've been involved in patient care for nearly all my career, member also of CENSAR. And, well, my relation with telemedicine is limited to the pre-evaluation for anesthesia. But in the Canary Islands where I live, we have a big problem of distance and moving through islands. So we are working a lot in telemedicine. We have some good projects ongoing and preparing other ones. But I don't want to speak about me. I would prefer my speakers to talk about their experience, which is much more interesting than mine. So first of all, I would like Anna to speak, because we are here for her and for all other patients that we may have in our hospitals or our primary care. So as she is the reason we are here. Okay, Anna, what factors influence patient willingness to adopt telemedicine services?
Okay. Well, first of all, thank you for having me here in this role as patient. We're all patients at one time or another, but I'm here on with that specific role, and I thank you all for having me. You were talking about, what is needed for patients to embrace telemedicine. And one is user-friendliness of the platform, first of all. If patients perceive this as an easy way to get a script filled, to check on their medication, what they need to take, or any other important or less important matter, and getting in contact with the healthcare team, that is very, very important. It has to be user-friendly, both for the patient and for the healthcare professional, of course. And another important matter, another important aspect is that they must, as patients, we must trust that the care we're receiving via telemedicine is the same care, is the same quality of care as in-person appointments. And that also privacy is kept, privacy as to what is discussed during the appointment and what is done with that data, the data produced. In my special field, which is diabetes, lots of data is transferred, is shared, and it is an important aspect that it remains private, that the person, the physician or the nurse on the other side of the screen is in an enclosed space or in a private place, the same as us. Because we don't want anybody overhearing or eavesdropping on what's going on. So that is, and that's very difficult. That is something we always think is not happening. Mainly those have the uptake portions. Their advantage, and this is one of the silver linings of COVID-19, is that it has made care accessible to people in remote areas, people with mobility issues, or people with other healthcare conditions that don't allow them to visit a doctor as often as they should. And I think that one important element to ensure proper uptake of telemedicine is training. Training for patients to know what to do, access to internet, to devices that enable this to be done, and training for healthcare professionals on how to deal with these kind of appointments, because it's not the same as having someone sitting next to you or across a table, and knowing and sharing the what, the when, and the how. Not everything can be addressed through telemedicine, and patients need to be aware of that as much as healthcare professionals. I think I've covered. And in some countries, to make sure that this is covered by insurance. Because if we have a national healthcare system that includes it, that's okay. I don't have to pay anything out of pocket, but in some other places, there might be a hidden cost in this, and needs to be addressed too.
Okay, thank you, Anna. Okay, Nuria, what is the industry role in all of this?
Well, thank you all for being here, and I hope that you can, okay, I think it's better now. So here representing the industry, which is at the end a variety of specialities, ranges of products and services. So I would like to be kind of generic on the topics that I think that are relevant on this topic for all of the industry. The current challenges that we have been discussing all along the day have had a direct impact on the strategy and the resources, capabilities, and all the needs that the industry need to put in place to be successful. And I think that the first one that is pretty linked, not specifically on telemedicine, but overall in the healthcare industry, is that the role has changed. We are not anymore a kind of single provider, kind of having a more transactional relationship with the healthcare industry, but rather be more a partner that we need to, from the beginning, understand which are the requirements from the pain points that the institution have, co-create on what is needed. And as we have been going through this whole day discussion, the main problems are not only on implementing the solutions or the products itself, but how to address all the challenges that are coming after that. So the role where we need to be closer and to really offer different services, different approaches, care, how to better engage with professionals is key. And I think that specifically on telemedicine, which has remote specific challenges because patients not necessarily are close to the healthcare institutions, are pretty complex itself in terms of adoption. The way we handle the needs are extremely painful. Also, not only from remote patients, but also within healthcare institutions, we have decentralized systems that are coping with monitoring of patients that are not physically close to the technology. So we have a lot of opportunities to engage, and I think that above all, we need to be more closer in getting the full adoption and successful implementation of technology, and to reinforce what is needed because of quality and regulatory requirements in this industry, but to reinforce the post-market surveillance of all the adverse events, all of the instances where systems are not working as intended or not fully understandable by patients or by technicians or by professionals. We need to work together to understand, to be aware of those, and to make sure that we are understanding why things are happening and improve design if needed, training, awareness, or whatever is needed to make sure that the technology is gaining the full speed and the scope and the intended design for which it has been deployed and shared with the institutions.
Thank you, Nuria. Okay, Michael, your turn. What would be the benefit of using telemedicine in a neonatal intensive care setting unit, and what equipment do you need?
Yeah, that's an important question. So we heard some examples, and I'm dealing in the hospital with very preterm babies, term babies, so the interaction when we use telemedicine is not us as physicians with the patient, but we usually use telemedicine to engage, to discuss situations, difficult situations, together with other providers. So I think for telemedicine, we need to distinguish between, do we use it for outpatient wards, do we use it for interacting with the patient, or do we need systems where we make sure that they are easy to use, reliable also, of course, and easy to use and understand by the providers. And especially in neonatology, I think we need more and more telemedicine in the future, because we know that we have a lack of physicians, and I think it's a global problem that physicians tend to work in centers, so in big cities. They don't want to work in peripheral hospitals anymore, so they have less and less physicians, or they have like general physicians, but not the specialists there. Specialists who are trained to deal with preterm babies with 23 weeks of gestational age and maybe 500 grams of birth weight. They don't know how to do thermal care, or when to intubate the baby, or what the next steps are. And you're alone there. You might have one nurse and one physician, and you need to take care of that baby in an very intensive, highly stressful setting. And then you need to take care of the baby, you need to take care of the parents, and you need to organize a transfer. You don't know where to transfer, you don't know how to transfer, and you're all alone. And you have a baby that's not breathing, that you need to intubate. And so that's a big challenge. And I think especially for those situations, telemedicine will be extremely helpful, because we can have providers in peripheral hospitals, and if a baby is there that's usually not born, like a preterm baby or a baby that needs intensive resuscitation, chest compressions, for example, then they can get in contact through a telemedicine system with the center that is specialized in taking care of those babies, and they can get help. But still, and that's the focus of my research, it's not only giving the peripheral hospital and the central hospital a telemedicine system and let the providers work with it, but we also need to find out what's the best way of interaction. It's things like what we heard before in the session about simulation. Also, it's about human factors, also in the telemedical system. How do you communicate? Who is the team leader in that setting? Or is it good to have someone who is the team leader, or is the person, the specialized person in the center, just there for answering questions if there are questions? And do we need some cognitive aids, for example, in telemedicine, to help also the expert to deal with this difficult situation? And we need a lot of training. So we also heard a lot about training today already. We need training with these devices. We need a good internet connection. We need companies that are providing us with systems that are easy to use. They need high quality of audio-video recording without any disturbances. So we're using systems, for example, where the remote consultant can control the cameras from his computer, and he can zoom in very, very closely in a very high definition. He can zoom out. He can see the vital signs monitor. I think that's also essential that you need to discuss what's the best perspective in such a critical situation. No, it's not so difficult if you're having an appointment with a patient to discuss, the patient is at home, and you discuss the medication, the next steps, and how the patient is doing, because you can just do like a Zoom meeting or so. Mm-hmm. So the telemedicine in a critical intensive care situation is completely different, because we need to discuss what monitors, and I'm also looking to you from the company Philips also, what's the best way to integrate monitors, so to make it feasible and easy to use in that critical situation.
Thank you. Well, let's move to Eduardo.
Well, first, thank you. I'm very honored to be here and discussing all these topics with everyone. I think that a lot of the messages resonate with the experience that we have had in Doccla. I think that there are like three elements that are very important to take in consideration at the moment of thinking in safety and telemedicine. So there are three, I will define it like three different stages that are very important. The first is when you are really defining the problem that you want to solve, and what is that design that you are going to be using to prepare your telemedicine platform. When you are doing that, you really have to do qualitative research with clinicians, with administrative professionals, with patients, very importantly. And don't see research as something that is static. It's something that have to happen. Like the first research that you do only is going to be giving you some of the first bits that your platform is, or the problems that your platform is going to be facing. So it's an iterative process that then at the moment of the implementation, when you are really implementing this type of platform to monitor patients at home, which is what we do at Doccla, you really have to talk with the clinicians that are going to be the day-to-day users of this platform. We are well positioned in Doccla in this particular respect, because different than other companies, we have our own clinicians, but we also serve with clinicians that are in the hospital. So we are able to enrich a lot of learnings of why we are making X particular change, of why we have to keep one particular feature stable in the platform. There is like a really intense drive to any change or any maintenance of any feature have to be driven by evidence that is coming from either the patients or the clinicians. And the third part that you mentioned is the post-market surveillance. Post-market surveillance have to be one of the top priorities of telemedicine. That's when you hear in the whole population that you are serving, that's from where the signal of all of this problem is coming. So having a very constant, periodic, and frequent evaluation of the data, any incidents is important to think about it, to evaluate if in an actual problem, what is the type of problems that make this arise? Is like human factor, is about the medical technology, is from the patient. So this, if you focus in these three stages and you hear what the patients and the clinicians are telling you, and you have a really iterative process about how to go about that and how to decide where the improvements for keeping the patients safe and also for providing to the patients and healthcare providers like actual quantitative outcomes that they can hang on. I think that this approach and like seeing this in these three different buckets could like really help us to move forward the field to, again, improve patient safety, patient outcomes, and also to drive change in different healthcare systems.
Thank you. Well, Viktória, your turn.
Thank you very much.
It shouldn't be easy to say tell us all your experience, how you implement telemedicine, the main challenges, the recommendations you could give us, and also the positive impacts that you found when you've done it.
Fernando, do you think could we use this slide? I'm project manager in one of the best and biggest hospital in Slovakia, and I would like to share our experience and maybe lessons learned from already implemented telemedicine projects. I have listened to my colleagues, and they mentioned all the important factors of successful telemedicine implementation in hospital. I don't want to repeat some aspects, maybe to add or stress some of them. What would I like recommend how to successfully implement telemedicine? Maybe share what was the main challenges for us and how we cope with. So it was mentioned, I think, by Julia, that is important at the beginning to make assessment of needs, patient and organizational needs, and then look at the telemedicine solution and answer the question, is the solution right for us? Is it meaningful? Can this solution cover our needs? And then set the goals. Yeah, the goals should be patient-oriented, because at the end we should have patient-centric outcomes. What we all want, I think, to have better access to healthcare in higher quality, increase patient safety and satisfaction as well. And these goals are interconnected with higher efficiency from the medical and the economy point of view as well. So, and I think how to manage the project effectively is really important to, at the beginning, to set multinational teams which are composed from nurses, so healthcare personnel such as physicians, nurses, IT specialists, project managers, administrative staff, and patient representatives as well. And it's very important clearly communicate benefits, challenges, and potential support in this process. And to achieve mutual understanding, I think is the key aspect of success then. And here was also mentioned that how the change management is needed, because we don't speak about the technical solutions. We need at the beginning to change mindset, because a lot of participants have in this process have a lot of concerns about telemedicine, and there is a bit skepticism why they maybe feel a lack of technical skills. It's something new for the patient and the healthcare provider. The patient are used for human touch, and not for, they don't want to have only technical devices. And the medical staff has some workflows, routines, and it's difficult to change that. So I think so really strong support, clearly communication is crucial for successful implementation. And yeah, I think, and it was mentioned here also, that telemedicine don't solve all the problems or challenges in the healthcare sector, but should be really helpful and could help address some of our problem. And I would like to add that maybe telemedicine is not suitable for every health provider, not for all patients, and not everyone, everywhere, and everyone. So I think it's very important to select the suitable patient group which is related to the goal. What we want, improve patient engagement in long-term management of chronic diseases, or one with better recovery in post-surgical patient. So it's really important to make a good feasibility from the clinical point of view, choose the proper group of patient who the most benefit from telemedicine, and then set standard operating procedures, protocols of patient enrollment, data collection, monitoring, alert system, and so on. Is, I think, not necessary to speak in detail about this aspect.
Okay, thank you.
What may be the last recommendation for healthcare providers which want to start with telemedicine is try with the pilot project. Smaller project to have the first touch with the telemedicine, to have the first experience, then have the feedback from all stakeholders, look how the KPIs are fulfilled, what is the process of successful implementation, because here is overall the space to be better and to improve the processes. And then we can achieve the set goals. At the end, I really would like to stress this, maybe the change management and the change of mindset in case of personal, so healthcare workers and patient is crucial. This is the first condition how we can change and implement the innovation in the healthcare system.
Thank you very much, Viktória. Well, we have our legal expert left. No, we were waiting for you. We need your help in telling us the important issues in the legal aspect of telemedicine.
Okay, there are many of them, but I'm trying to adapt to the time Fernando has given to us. And I would like to start telling you how we, a legal firm, came into the patient safety. We are a law firm specializing in defending professionals and institutions against med malpractice claims. So we always have thought that as jurists that law has to be has to play a significant, central role in the healthcare scene. But at some point, we realized that no matter how high is the limit the professional has in their PI policy they have taken out, no matter how can we be on court defending the interests of the professionals. Nothing matters if we are not capable to avoid or to prevent that the damage will happen again. So at that point, we decided that we have to start working with this risk management in healthcare, which is called 10 or 15 years ago. Today it's known by patient safety. So we start working with this kind of initiatives such as FIDISP. And we have been doing that for more than 20 years. Our contribution is in the field of helping professionals and managers to understand that they are exposed to some particular legal risk in their daily basis performance. And this is also to work for the safety of patient, okay? Or that's what we think. I will move on to the today's topic is the legal risk in telemedicine. Here I brought you a slide we generally use in our trainings to explain healthcare professionals, what risks they have to face in his daily basis. But these risks not only apply to patients, but also to professionals and institutions, because sometimes it is impossible to separate them from one to another. So we could identify the first set of risks, and these ones that are related with the most intimate sphere of the patient. I'm referring to the informed consent, of course the data protection, but also the privacy or the capacity by the way the professional, the healthcare professional who is dealing with who is assisting the patient is liable for the assessment of the capacity, the legal capacity of the patient in order to understand the information who is being given, or even to make a decision to go under surgery or not. And this is something very important in the patient safety arena. Of course, data protection, we are I think we all have in mind right now how sensible and how vulnerable we are about data protection. But I think we have to be especially, or it is especially important in telemedicine because in some way, in some extent, data is traveling from the home of the patient to the hospital. It's going out of the IT system of the hospital. So we have to stream the care of duty, or the duty of care, excuse me, in this kind of processes. As a second set of bunch of risk, I have to refer to the technological risk. And believe me, these are the ones I am more concerned about. You know, as far as in telemedicine, the care is provided at a distance. A device has to, or we need a device in order to contact to, or to communicate to, or to act on the patient. So these devices are combined or used an increasingly more complex and software. And this software, it's making or allows these devices to be more and more, or have more and more functions, to be more autonomous, and especially since the advent of the AI. Three are the main characteristics that the European directive about AI liability recognize in the AI, and which is complexity, autonomy, and excuse me, I don't say it in English. No, it's opacity, excuse me, opacity, okay? So as you can imagine, this is a huge concern in the legal arena. A lot of questions arise from this topic. I have to say that I come here to you with more questions than answers regarding the telemedicine and the regulation of telemedicine, and especially in the liability field. I have questions also like, is a system or a machine using AI is enough to discern about what is wrong or what is right, or what is legal or illegal? Can they legally be held liable of their actions? Or can they respond of the damages they may cause in an assistance? And if they're not, who actually have to? Yeah?
That's a great question.
And the last question for me is if the rules and principles we are managing right now in AI systems, it's adequate for the AI advance. And finally, I want to make just a brief comment about cyber risks. I just want to share with you a message. All professionals we are related with healthcare, or all hospital employees, excuse me, must be made aware of what consequences have that they don't follow the instructions of the IT department about cybersecurity. Because right now, and I'm sure all of us have an example in mind, a cyber attack can even paralyze a hospital. And sometimes, like the cyber attack that suffered the Düsseldorf hospital in 2020, a woman dies because she cannot be attended. So I always tell in the training sessions, the case of a hospital that was being paralyzed with ransom malware, that entry in the systems through the laptop of the manager. Because he was working at home, and he was working on the weekend, and he was connected to the corporate system, but he decided to take advantage of his time, and at the same time he was working, he think that it was a good idea to download movies from EMU webpage. And in one of these movies, Marvel one, a ransom comes into the system, and the hospital was paralyzed for hours. Fortunately, no one dies, we have no fatalities, but consultants has to be rescheduled, and many surgeons has to be canceled. Okay, so what is all that I have to do? I think that the legal sector is facing a chilling and exciting moment, and regulation has to make a step forward to catch up with the last technology advances. That's all. Thank you.
Thank you. Okay, we heard a lot of experience from all our speakers. We have 10 minutes left. So if anyone has a question, you're welcome now to make them. In the meantime, I may have some more questions for you. Anna, we have more and more devices and softwares and for telemedicine. So how can we manage all that, and in which way can we promote that the patient uses good tools, telemedicine?
Well, my disease area is especially prone to technology. If you're a type 1, you wear technology. Right now, I'm wearing 4 interconnected devices on me. So, yeah, it is there. There's an advantage, too, because my endocrinologist or my primary, no, he can do it. He can log in, check my numbers, check where I am, etc. And if action is needed, he can act on that information, because I have shared all my passwords with him. It's not the healthcare system, it's me, myself. But other than that, it's all you need is a phone, actually, as a patient, a good phone and an internet connection to access telemedicine, and that's all you need. And that is a great advantage, because you don't have to travel. You don't have to even get dressed, wear shoes or anything. You just have an appointment, log in, check with your doctor, ask all your questions. He or she has all the right answers, and you get your script logged onto your pharmacy or sent via WhatsApp or email or whatever system. So for us, it's great, actually, for regular things. Of course, things that can be done online. You know? If I need to have a tooth fixed, no way, that's not going to happen. All I'm going to get is a painkiller and come back tomorrow.
Okay, thank you. Well, no questions?
Where's the mic? There.
It's coming.
There, on the table.
Well, I feel bad because I asked a question in the last session, but the trouble is, it's the fault of the organizers. It's such an exciting conference, I can't resist. It's your fault, sorry. I'm just going to challenge. I'm a great passionate believer in telemedicine, so I'm an enthusiast, but I want to ask a slightly skeptical question to be provocative. 30 years ago, I was a GP, and I would speak to patients in urgent scenarios at night on the telephone. More than half the time, we would resolve the matter by means of a telemedical consultation, if I'm brave enough, on a telephone. And if, for example, they were a diabetic patient, I might say, well, what was your blood sugar reading before you called me? And they would tell me. That is, forgive me, remote monitoring. I would have, when I was a junior doctor and I was not sure what to do, I'd ring my consultant at home who would decide whether to just give me advice or to come in to the hospital. That was another kind of expert system. Yes, massive innovation, massive sophistication, massive scale. Is it really a paradigm change?
Well, I think we have some expert here to answer to that. We already heard Anna because she is giving a lot of more information than just one blood sugar measure to the practitioner. But for example, Eduardo has a lot of experience in telemedicine with different types of illnesses, and now we have different devices to monitor them. Can you tell us about it?
That's a fantastic question, and it's a question that is always around the discussions with my team. You are right. Over a phone call, you can capture a lot of the information in a reactive way from a call from a patient. I don't think that this is a massive paradigm shift, but I think there is a very important improvement on the aspect of the proactive care. Because on one side, yes, if you receive a phone call from a patient, you can act onto that. But there are many symptoms that patients are not able to recognize, that with sensors we are able to either predict or have at least a good sign that the deterioration will come, and then we can proactively take care of the patients. And this is something that we are seeing not only Doccla as a company, but also if you go to the scientific literature, this is one of the main use cases where the big progress have been seen. So I mean that's a short question. That's a short answer to your question. But yeah, I mean if anyone else wants to add on.
Thanks for the questions. Thanks for the questions. Very interesting, and I totally agree. We don't need to have technology everywhere and include technology just because we have it. Sometimes a simple phone call might be enough, but it really depends again on the situation. For example, in my clinical work in neonatology, we also do phone calls, and the fellow calls me and tells me, hey, the patient, the breathing is not good and the saturation is dropping and the ventilation settings are like this and that and the blood gas. I mean, it's good for, getting the blood gas and the blood sugar and all that, but sometimes it's just about seeing the patient, seeing the situation. So the fellow tells you, everything is okay, I checked everything, but he or she might not have the experience to fully understand if there's a problem. And if you have the possibility to see the setting and to check the ventilator on your own again, to check the perfusers again, to see the patient and to see, is the breathing okay from your experience as a consultant and many years of clinical work, or do you think that the baby needs to be intubated like now? And I think that makes a huge difference. So we really need, again, to see what situation we have and where we need technology and also advanced technology, and where it might be just enough to have phone calls or, I don't know, video calls.
Would you say we need more than just data?
Yeah.
Yes, please.
Sí, me ha animado a hablar después de escuchar a mi predecesor en la pregunta, porque yo trabajo en el ámbito de atención primaria, que es un ámbito del que nos ha hablado mucho, y para nosotros la telemedicina
about primary care, and for us telemedicine is telephone, and the telephone is very simple to use, and it's always been there. And because of one of the panel members said that you need artificial intelligence to predict that, we do this with a simpler approach. In chronic disease, nurses proactively call them without any need. They call on a monthly basis or according to protocol and the checklist the chronic patients. And they ask a number of questions where they predict the possibility of decompensation or exacerbation of the patient, and they anticipate. For example, if you're in heart failure, COPD, we can act before there is actually a serious exacerbation, and they can do that, nurses. We do it very easily, proactively, and we don't call it telemedicine. And we've done it for years. I know it's a kind of telemedicine, but if you give them a device and they're sending good information, it will be an improvement. Yes, well, we new devices that take your blood pressure and are connected to the physician's systems, it will be so much simpler. And in primary care, the telemedicine is sending the photograph to the dermatologist so that he can have an opinion. Okay, and this is very simple, and we've implemented it for a long time. Or the patient calls on the telephone with a doubt of the medication, can be talking to the pharmaceutical in primary care and solve the doubts over the medication. Yes, the telephone was the king of the pandemic. Well, it also has some problems, but actually chronic patients now in Spain, there is a platform of organization of patients that can have a report on how chronic diseases were cared for during the pandemic and what the patients had as an opinion. It was not good. There was too many delays. Some diseases suffered.
Pandemia, we had some delay with some patients to taking care of them, although we were calling them. Okay. Anyway, this is real. This is telemedicine, teledermatology, telecardiology. We have a good example with Philips in Canary Islands, sending small briefings and ECG and limiting cardiologists consulting. So that's great, and it's a very huge project with a lot of success. So I want to just read this slide to take home, and I think we are just on time. We need telemedicine, and it should align with patient health needs and use an evidence-based approach. We need user-friendly interfaces, better understood, increased safety, better outcomes, and we need to identify them. We also need stakeholders' engagement. We have to integrate them into the clinical workflows to enhance patient safety. Management should be, have clear vision, strong leadership to identify the problem and to help solve it. Empower clinical teams with training, with clinical safety protocols, reliable technical infrastructure, interoperability, user-friendly solutions, data security for our legal problem, privacy policy, regulatory compliance, KPIs, and also outcome monitoring and continuous improvement. We are here for the patient, and telemedicine is for them. Thank you very much.
Thank you.
Thank you, all of you. It's been great.